I'm Michelle Franklin, and I'm the CEO at Sullivan County Community Hospital. I'd like to give you several updates today about the status of the coronavirus and the hospital's preparations to deal with what we would anticipate at some point to be a surge of patients coming to our facility. First of all, I'd like to take the opportunity to thank our community. We've had so many volunteers who've offered to make us masks, gowns, volunteer to bring in snacks for our staff, and certainly anything that our community is willing to do to help support us during this time of need, we greatly appreciate. So thank you very much. I have had several questions come up about the coronavirus and the hospital's preparations in the event of the surge, and I want to make sure that I address those questions. So I'm just going to start off here with, can you tell me how many positives we've had in our community and how many tests have been ran? And yes, I can. As of this morning, we have tested 37 patients in our community, and we have had 5 positive cases. Out of those 5, only 1 has been a Sullivan County resident. And out of those 37, we have 7 tests that are still pending results, either through our commercial lab, LabCorp, or through the Department of Health. One of the things that I have had a question about is whether or not we have received any volunteers in our community who are healthcare workers that are retired, that have spoke up and are interested in helping us during this crisis. And the answer to that is yes as well. Dr. Steve Dupree, of course, everybody in our community knows Steve, has volunteered to help provide services once we have our surge of patients. I have been in direct contact with him, and he is going to be working our unit that will be staffed with a physician in the event that we have a number of coronavirus positive patients needing inpatient care. So we don't know when that will start, but yes, we have had a physician volunteer in our community to step forward. So we're, again, very appreciative to Dr. Dupree for that. Quick Care is still in operation. That was another question. And the hours in that clinic have not changed. So certainly, yes, we encourage you, if you need to utilize Quick Care as an option for sick care as well. Internally, we're making several preparations for dealing with our surge of patients. As many of you know, through CDC and Department of Health guidelines, there is a requirement to take care of those positive patients in negative air rooms. And our hospital had very few of those until we began surge planning. And so we have established a whole wing that is now dedicated to negative pressure rooms that are perfectly capable of handling coronavirus positive patients. Also, when you come into our hospital, as many of you may know, you're still being screened at the front of our hospital, and should you be positive for any symptoms, we are then giving you a mask and asking you to wear that mask while in the hospital. And then I'm sure that Dr. Ellis then will answer a couple of questions specific to coronavirus, such as what do I do if I'm sick? And then if you're fearful of coming into the hospital, coming into the clinic, what is the option that we have for telehealth visits? And so I'm going to let Dr. Dustin Ellis, our Chief of Staff, deal with those 2 questions. And again, thank you for your support. And I'm sure as we move through the next coming weeks, we will still have more additional video output to you so that you know exactly what's going on here at your community hospital. Thank you very much.
Hi, I'm Dr. Dustin Ellis. I'm the Chief of Staff at Sullivan County Community Hospital, practice here at Lakeside Family Medical. Just first and foremost, want to say that we appreciate the support of the community, all of our patients. Y'all have been great. I know that you're reaching out in a lot of different ways. People are really pitching in as a community. Makes me proud of our town and proud of our surrounding communities. So we want you to know that we really do appreciate your support, and we feel that love. Just want to go over a couple of points. One thing, at Sullivan County Community Hospital, we do have telemedicine visits available. All you have to do is call your provider's office. If you see one of the Sullivan County Community Hospital providers, it's either at Lakeside or at Family Practice Associates. Let them know you'd like to schedule a telemedicine visit. You'll get a time, and then you'll get a link either texted to you or emailed to you. You have to have a device that has a camera and a microphone. Smartphones are the easiest way. We'll text you a link when we're ready to connect with you. You click on that link, then you'll be connected to a two-way chat with us. We can discuss what's going on medically with you, talk about your medications, go over anything that you need to have care for. That way you will be billed like a normal office visit. Insurance companies are reimbursing for these, so just want to let you know that's an option. Great way to connect with your provider and still get medical care without going out of your home and being exposed to potentially other people who are carrying virus. So the other thing is, if you do fall ill, if you develop symptoms of cough, fever, shortness of breath, we advise that you call the office. Let us know what's going on with you. A nurse will take some information, we'll make some recommendations. If people have mild illness, they have cough, they have fever, but otherwise aren't having any trouble breathing, shortness of breath, those kind of things, we're basically recommending people stay home, avoid any contact with anybody. You need to be home for at least a week if you do have symptoms consistent with COVID-19. You don't need to be coming out at all until you're 3 days without any fever, without taking any medication. It has to be at least 7 days. Could be longer than that if you're still having any of those symptoms at 7 days. So that's the recommendation right now. If you're really short of breath, struggling to breathe, those kind of things, obviously once you come to the emergency department to be evaluated. If you can call ahead or have a family member call ahead and let them know what's going on, what kind of symptoms you're having, that way they can be prepared for you when you arrive. That's the best case scenario. Again, we just appreciate the support of the community. Continue to social distance. So only people that are in your household should be in your home. And visits outside of your home really ought to only happen if you're an essential worker. So if you have to go to work, if you're providing some kind of essential service, or if you need to get groceries, essentials, one person should be going out and doing those visits. We don't recommend the entire family going into the grocery store, that kind of thing, obviously. If you can make a homemade mask, there's lots of videos out there. Surgeon General talked about that over the weekend. It's a good idea to protect others around you. Some people can shed virus without having symptoms yet or knowing they're sick, so you're doing that to protect others. But it's not a substitute for social distancing. Wash your hands frequently. And a few more weeks of really good social isolation, and I think we can move forward as a country and hopefully begin to return to some normalcy in the coming weeks and months. Again, we appreciate your support. Continue to pray for our community, and thank you.